Are you suffering from sharp knife-like pain in your back or basically anywhere? No worries, we got you covered. Keep watching for the information. Don't forget to hit the like and subscribe button so you can keep getting tips and strategies on how to stay healthy. What do you do when you have severe knife-like pain stabbing you in the back by your scapula? Some people reach for non-steroidal anti-inflammatory drugs such as ibuprofen, Aleve. Well, these drugs do take down the inflammation, but they don't fix the problem. And there are side effects with these drugs. It can cause gastrointestinal problems, can cause ulcers, could even cause kidney damage. So there are other alternatives. Some people think maybe a cortisone shot. Well, cortisone shot also reduces inflammation, but the anti-inflammatory drugs, the cortisone shot, does not fix the problem. That's where I come in. Hi, I'm Dr. Stephen Goldstein. I'm a chiropractor, and I've been practicing chiropractic in Lynbrook for over 40 years. I don't know where that time went. So we're talking about knife stabbing pain in the back of the shoulder. The patient comes in and they say they have knife stabbing pain in the back of the shoulder. Many times it's from a subluxation from what's called a rib head. A subluxation is when a bone goes out of alignment, putting pressure on the nerves. In the spine, it puts pressure on the disc, pressure on the joints, and that causes inflammation, and it can be some severe pain. So let me explain what a rib head is. The ribs attach to your sternum. They go around to the back. We're going to use Stanley as a demonstration. They go around to the back where they attach to what's called the transverse process on your vertebra. They're attached by ligaments, and there's very little room for any inflammation to actually occur. This irritates the surrounding tissue, the surrounding nerves even more, causing that stabbing knife-like pain behind the scapula in the back. Not only does a rib head being out of alignment causing a subluxation producing this inflammation and knife-like pain, but you also have muscles that attach to the medial border of the scapula called rhomboid muscles, and those rhomboid muscles also become irritated, causing a lot of inflammation and a lot of pain. Much like when you sprain your ankle, there's very little room for inflammation, so the tissues around the ankle joint swell. Well, there's not enough room for those tissues in the back by the rib head to swell, and it causes severe knife-like pain. So the attachment is almost like these two fingers coming together. Think of your fingers wrapped around together by ligaments. When the head pops out a little bit, it causes severe inflammation and severe pain. So I'm going to show you what I do in my office to determine if the rib head is actually out of alignment and what I do to make the correction. When the correction is made when you have a rib head subluxation, the relief is pretty much instantaneous. Times that rib head being out of alignment has been there for months, might even be there for years. The pain might come and go. You might have degeneration in the area, so sometimes a number of visits are required just to get that rib head to move back in place, reduce the inflammation, and allow the body to start the healing process from the inside and healing naturally. So if you want to find out about more tips and strategies for better health, then hit that like and subscribe button. It does help my channel to grow, where we can reach more people where they're looking for answers on how they can improve their health naturally and without drugs. So stay with me. We're going to go in the other room and I'll show you exactly what we do to alleviate that knife-like pain behind the back in the scapula area. Talking about knife-like pain in the back where the scapula is. So I want you to point to your pain. And most patients will point to that area right over here. Take your hand away. Great. And it feels like knife-like pain, correct?
Yes.
So the scapula is right about here, and you have rhomboid muscles that attach to the scapula and then attach to the spine. And when that rib head pops out, that's where it causes inflammation and severe pain. So we're going to show you where that rib head is and how we fix it. Whenever a patient explains knife-like pain in the back and they point to that area of the scapula, this is the area that we're talking about. And so to palpate where that rib head is, we just come up along the medial border of the scapula, and then we can find exactly where that rib is. Tender when I press in?
Yes.
Okay. So if you press in and the patient says, yeah, that's tender, and sometimes it's very tender, that's where the rib head is. So in order to adjust it, we have the patient bring their arm up like that, drop their elbow, so they're pulling the scapula away, giving us more space to adjust that rib head, and then we just come in, and that's the adjustment. And once we release that, the inflammation starts to subside, and most of the time the patient feels immediate relief. But if that rib head has been out of alignment for months or even years, then it might take a couple of more visits. Thank you. So I just showed you how we adjust a rib head, and I was checking out Alex, and actually there's a heck of a lot more that needs to be fixed. So I figured, why not continue and show you how we evaluate and adjust the patient from top to bottom or from head to toe. So one of the things that we use is applied kinesiology. It's muscle testing. If I touch an area that needs to be adjusted, a strong indicator muscle will go weak. So we're going to check her low extremities first. So first we're checking her knees. So both knees need to be adjusted. We're checking her quadriceps are strong, her hips are strong, her ankles are strong. So we're going to adjust the knees. You're not going to hear any type of popping sound, but it's a very minimal adjustment to the knees. And if we made the correction, when we retest, the arm stays strong. The other thing we check is the jaw. So we're going to do that next. The first thing we test is, does the jaw have to be adjusted externally? And then we can check, does it have to be adjusted internally? We'll ask the patient to clench her teeth and open her mouth wide. And when she opens her mouth wide, the arm goes weak, indicating that there's some derangement going on in the jaw. Usually that indicates what's called the pterygoid muscle. We adjust the inside of the mouth. It's along the back of the molars. It doesn't cause the patient to choke or gag. And what I usually tell the patient, once we put the glove on, what I usually tell the patient is, I'm going in with a finger, I want to come out with a finger. So again, we're going to do that muscle test to see which way we have to rub out the pterygoid muscle. And open. And when the arm goes weak, we have to rub it out in the opposite direction. In this case, it's a clockwise rub out. And again, on the right side, we're rubbing it out clockwise, stimulating the muscle fibers and the nerves to get that muscle to start functioning normally again. And then to test, we have the patient bite down and open wide, and the muscle is strong. Next thing we're going to do is check to see if her cranial bones are pumping cerebral spinal fluid when she inspires or expires. So we ask the patient take a deep breath in, the muscle is strong, let the breath out, and on the breath out, her arm goes weak. So it's called an expiratory assist, and this helps the cranial bones pump cerebral spinal fluid throughout the entire nerve system. Take a deep breath in and let it out. Again, deep breath in and let it out. And to test if we made the correction, deep breath in, let it out, and both times the muscle stays strong. Thanks, Alex. I want to ask, which one of these tips that I just demonstrated resonated with you the most? And did this address any health issues you might be having? Leave a comment so I can get to know you better and see what you guys have been thinking. Thanks for watching, and I'll see you next time.